we will now look at the different types of adaptive immunity. So just to quickly recap, immunity is separated into innate, which is what you're born with, and then there is the adaptive immunity. So within the adaptive immunity, we talk about how there are cell-mediated immune response, and then there is antibody-mediated response. But now we're going to be talking about classifying adaptive immunity based on how you got the immunity itself. So adaptive immunity is separated into two categories. We have what's called active adaptive immunity, and we have passive adaptive immunity. So in active adaptive immunity, it means the host, which is you, the person, right? Host makes antibody. Okay, the hosts themselves are responsible for making the antibodies. And on the other hand, for the passive adaptive immunity, rather than making their own antibody, the host receives antibodies. Okay, receives antibodies. So they're going to get it from someone else, and we're going to look at some examples of it later. Because you are making your own antibody in active immunity, then it's going to take some time. So this is not immediate protection. However, you will be making memory cells, and therefore it's going to be long-lasting. Okay, long-lasting. On the other hand, for passive immunity, because you're receiving the antibodies from someone else, it's going to be giving you immediate protection. As soon as you receive those antibodies, you are going to be protected. But because you did not make the antibodies yourself, that means you don't have the memory cells for it, and so this will be short term. Okay? It's kind of like cheating on a test. Right? If you cheat, you get the answer right away, but you won't remember anything. But if you study, you won't remember everything right away. But once you take the time to study, you will get long-lasting memory. So under active immunity, there are two examples, two categories rather. We have natural and we have artificial. Okay, same thing for passive. Okay, so we have natural passive and we have artificial passive. Okay, another word for artificial, sometimes you will see textbook write induced. Okay, so natural just means it happens naturally, and artificial means you deliberately do something to trigger it. Okay, so therefore there are three types of adaptive immunity in terms of how you get that in the first place. So there's natural active, artificial active, natural passive, and artificial passive. Let's take a look at the specific examples for these things. So let's start with natural passive. Natural means it just happens, right? A good way to tell whether something is natural or not is to think about if this could happen thousands of years ago. Okay, so in the case of breastfeeding, it's considered as natural. And passive means you get the antibodies from another person. So in this case, that other person is going to be the mother, right? The mother can transfer antibodies to the baby through the placenta, right? And we actually know this, right? We know for RH sensitization, right, for hemolytic disease of the newborn, the RH antibodies actually cross the placenta to attack the baby's red cells. But in this case, we are talking about good antibodies. So if the mother has anti-measles antibodies or something, those will be able to cross the placenta and go into the baby's body and to protect the baby that way. These antibodies will disappear soon, within a few months, and then the baby will be susceptible again. And so the mother can prolong these protections by breastfeeding the baby. Okay, so breast milk actually contains antibodies, and those can offers protection for the baby as well. Okay, so this is example of natural passive. Okay, it's natural because it happened naturally, and passive because the mother makes the antibody, not the baby, not the host. Okay, so once the breastfeeding stops, right, the baby would have to eventually make their own antibodies by encountering the illness through other means. Artificial passive, okay, so artificial means is deliberately done, and passive means you did not make the antibody yourself, right? So there are two examples of this. Artificial passive can be used as a preventive measure, okay, prevention, or it can be used as a treatment, okay? And I'm gonna tell you about this right now. So we can use it to prevent an illness in someone who has been exposed to an infectious disease, right? So we actually can take antibodies from someone who has immunity for a particular disease, and we can purify the antibodies from that person, and then we can use that and give it to someone else. So here is an example, right? If a healthcare worker who accidentally stabbed themselves with a needle, and that needle was just pulled out from someone with hepatitis, then there's a real chance that the healthcare worker is going to have hepatitis. So as an immediate treatment, what you can do is the person can receive an antiviral antibodies injection, and again, this is what we call a serum, which is basically purify antibodies from someone who has the immunity against hepatitis in this case, and then that will help prevent the virus from causing the infection in the person. Okay, so there are wide ranges of diseases that can be treated this way, right? So including botulism. Botulism is like a type of food poisoning, right? You might not have heard of botulism, but you probably have heard of like Botox, right? Botox is injecting something right underneath the skin and takes the wrinkle away, right? So that something is actually the same toxin that causes botulism, right? It causes your muscle to become paralyzed, and in high doses it could cause you to die. So if you come down with botulism, you can use a serum to treat that, right? And that's an example of artificial passive immunity. Rabies, if you get bitten by like a stray dog or something. Tetanus, if you get cut by rusted nails, for example. So the protection is immediate, right? You will have the antibodies to fight these things right away, but it's short term. So next time you get bitten by another dog, right, then you will need another serum, right? So that's an example of artificial passive, right? You're injecting something into yourself. That's artificial, and it's passive because someone else gave you the antibody. You can also use this as a type of preventive measure rather than treatment. So let's say I have to go on a business trip tomorrow to some place with a very prevalent disease, okay, and I don't have time to get a traditional vaccination, so I can ask for a serum, right? So by getting the antibodies, I will be protected for that disease immediately. But after I return from my trip, then I will lose that immunity because again, it's not meant for long-term protection. Okay, passive immunity are just going to be good for short term. Next, we have natural active immunity. This is perhaps the one that you're most familiar with. Let's say you contracted chicken pox. You went through the symptoms of having the pox, but then you recovered, and now you're protected for life, right? You're only going to get chicken pox once in your lifetime. That's because once you recover from it, you are going to have the memory cells for it, and so you're not going to get it again. Some people do get it as in the form of shingles later on in life, but that's not the majority of the population. Next is artificial active. So this is to get vaccinated against a particular disease, right? So in the vaccines, you would have a weakened form of the virus or of the bacteria, and sometimes it's the dead version of the bacteria or the virus. and you use that weakened version to educate your immune system, and you will produce antibodies against that and create a memory cells. So when the real thing comes, you are going to be protected. Okay, because the actual virus and the actual bacteria is not used in the vaccines, it's impossible to get sick from the vaccines themselves. Meaning, if you are going to get vaccinated against chickenpox, you are not going to get chickenpox from the vaccines, right? Same thing. If you receive a flu shot, you're not gonna catch the flu from the flu shot. But some people say, you still get a fever, you still get a muscle ache, and that's true because when you inject the vaccines into your body, you are introducing foreign antigens, right? That's kind of the whole point, right? To educate your immune system about these foreign antigens, and anytime you have foreign antigens in your system, your innate immunity is going to kick in as well, right? So the fever is part of that. Okay, but it's impossible to get the illness from the vaccines you're getting. So here is a graph that shows you when you first exposed to the vaccine, you're going to create plasma antibodies because of the activation of B cells and so on and so forth. And within a certain time frame, if you give a second dose of the vaccines, a booster shot, that response is much stronger, and it doesn't come down as quickly. So for this reason, it's not uncommon for the vaccines to have several dose, multi-dose, to create the most effective immune response. So who came up with the idea of vaccinations? Okay, so in the history of mankind, we have only successfully eradicated one disease, and that is smallpox. Okay, so smallpox is a very serious contagious infectious disease caused by the variola virus. Okay, so people who had smallpox, they would get a fever, they would get a really distinctive rash like this one, and most people with smallpox recover, but about 3 out of 10, that's a 30% mortality rate. Okay, so that's really big, right? And some people who survive will have permanent scars all over their body, especially their faces, and some are left blind. So very devastating disease, and there were no effective treatment for it. And so there was this English physician. His name was Edward Jenner. Okay, so Edward Jenner, he observed that the milkmaids, the people who milk its cows, they got they got something called the cowpox from the cows. Okay, and then he noticed that if they recover from the cowpox, then they do not show any symptoms of the smallpox when exposed. So here's the story. Okay, he has a cow. The name of the cow was Blossom. And Blossom has some sores in the udders. The udders is where you get the milk, right? And so the milkmaid, one of the milkmaids, her name was Sarah, and Sarah was milking Blossom, and she caught the cowpox from Blossom, and so there are these cowpox that are growing on her hands, and then she recovered from the cowpox. Okay, cowpox is not a serious disease in humans. Okay, and so later on, Jenna found out that Sarah seems to be affected by the smallpox, so he theorized that if you recover from cowpox, maybe it will give you protection from smallpox. So to test his hypothesis, he took the gardener's son, right? Not his own son, the gardener's son, right? A 9-year-old boy named James, and then he exposed him to cowpox. And when the boy recovered from the cowpox, he then do something crazy. He exposed the boy to smallpox repeatedly. Okay. You can't do this nowadays, right? You're gonna get sent to jail for life. But back then, the ethical guidelines were not so clear cut, I guess. And it was very fortunate that Jenna was correct, that the boy actually did not get sick from the smallpox. And based on what we discussed about antibodies, you would know that this is a very, very unusual situation, because typically we produce antibodies specifically for one type of disease, right? And that antibodies will not work for another disease. It just turns out that in this case, the smallpox and the cowpox are so similar that when you get infected by the cowpox, you will also get protection from the smallpox. So that began the creation of the first vaccine, and what happens is after mass vaccination using vaccines created from the cowpox, people no longer get sick from the smallpox, and by the end of the 1977, there were no more naturally occurring cases of smallpox. Okay, and so the cow Blossom, when he died, when she died, sorry, the hide was made into leather, and that was given to Canada as a gift. And you can find the hide of Blossom at the Medical Science Building in University of Toronto. So this concept was not uncommon of inoculating an animal version of a disease to get protection for a human disease. We actually do this for tuberculosis. So if you have a little scar on the on your arm, usually the left arm, if you're right-handed, there's a big scar on the arm. That's from the BCG vaccine. So that is the cow version of tuberculosis, and that is supposed to give you protection for the actual tuberculosis. So many people from Asia country, including myself, would have that scar because we received the BCG vaccine when we were little, when it was a very prevalent disease in these countries. So let's talk about a little bit of ethical controversies surrounding vaccines. So how many provinces and territories in Canada have mandates for vaccination? So a mandate is basically the government imposing rules that people need to get vaccinated. So what's your guess? How many provinces and territories in Canada would have mandates for vaccinations? Well, the answer might surprise you. It's only Ontario and New Brunswick that have vaccination mandates. So in Ontario, we have something called the Ontario Immunization of School Pupils Act, or ISPA for short. And this act requires that any kids attending primary or secondary school must be properly immunized against a designated list of diseases unless they have a valid exemption. And if you do not have the required immunization, or if you don't have the record for it, and if you don't have a valid exemption reason, then you might be suspended from school. And here is the list of a mandate vaccination for all individuals. So in 2 months we have vaccination against diphtheria, tetanus, pertussis, and so on and so forth. And this kind of continues all the way to grade 7. Okay, and then another shot at 14 and 16 years old. And then after that, these are not technically mandates because by then you'll be out of secondary school and they can't really enforce it anymore. But for kids in high school and in elementary school, there is that act for mandate. So every year around March and February, schools actually sends out a bunch of suspension letters telling people you're gonna get suspended if you don't show the proper immunization record. And it's not that people don't get vaccinated necessarily, but sometimes people who immigrated from another country, they don't necessarily have the full immunization record, right? I mean, we have the yellow card, right? But then it's not the best way to store these kind of medical record, right? The card can be lost, for example, and there's no backup necessarily, and so a lot of people don't necessarily have the complete record, and as a result of that, they could face a suspension. So what are some of the valid exemptions that you can have to be exempted from ISPA? The valid reasons include the following. First, you might have prior immunity. Okay, so for example, in our vaccination mandates here, there is a varicella. Varicella is the virus that causes chicken pox. So, you might not need that if you have prior immunity. Okay, you might have caught chicken pox like through the natural way, natural means, right? Then your body would already have the protection. So you won't need a vaccine for that. So you will be exempt, right? But to show that you have prior immunity, you might need to take an antibody test, and that antibody test might not be covered by OHIP. Next, medical contradiction. Not everybody can receive vaccines. Some people are immunocompromised, right? They might not have a strong immune system because of the genetics, or maybe they have HIV, then they're not necessarily going to be able to get vaccinated. They might be undergoing cancer treatment, which makes them not going to be able to get vaccinations. So all these are medical contradictions that would prevent someone from getting vaccinated, and so that would be a valid reason to not get the vaccine. The last one is the one that is under very hot debate. Okay, there are strong arguments from both sides. Okay, you can get exempt from vaccination based on an affidavit. An affidavit is basically a sworn statement that you can use in court, and that could be an affidavit of conscience or religious belief. So because there are a lot of people who don't believe in vaccinations for various reasons, and they are using this last reason to basically get their kids to not vaccinate. And as a way to kind of counter that, as of September 1st, 2017, parents who use that last option to get exempted must do the following. They must go to a local public health unit to complete an education session. And this session aims to provide them with basic information about immunization, vaccine safety, right? A lot of parents are not comfortable with the vaccines because of, things that they hear from friends, maybe from the internet, things that they read, right? So safety is a big concern for them. So, maybe if they get educated about it, they might change their mind. Immunization and community health, as well as immunization law in Ontario. So this would be an info session for the parents, so at least they would be able to make an informed decision rather than one that's based on just feelings, for example. So what's the proponents' arguments for mandates, right? What's the reason of having a mandate? Well, the main rationale behind imposing a mandate for vaccination is the concept of achieving herd immunity. Okay, you probably have heard of the term herd immunity, right? Particularly in the midst of a pandemic that we're going through right now. Herd immunity is something that's really important. And the concept is that when a critical portion of the population, typically the cutoff number is 95%, if 95% of the people in the community, in the populations, are protected against a contagious disease, then most members of the community are going to be protected. Okay, that remaining 5% is going to be protected, right? So in an ideal world, the 5% would account for people who cannot get vaccinated for other reasons, okay, for medical reasons, or because they're too young, too old, right? And so they're relying on the 95% who are protected to shield them away from the disease. So here is a picture. If only some people get vaccinated in the population shown here by yellow, and there is an infected person, the red person here, then this red person can spread the disease to all these unvaccinated individuals, and then you can have an outbreak. But if most people are vaccinated, shown here by the yellow individuals, and you get a sick person, then it's more difficult, right, for this red person to infect other people, right? So you will have fewer infections. So herd immunity is a strong argument for having a mandate. The counter argument, right, the opponents for mandate is that some vaccines are controversial. For example, there is a vaccine that protects against human papillomavirus or HPV. So HPV is a virus that could it is first of all is a STD, sexually transmitted disease, and if a girl get HPV, their chance of getting cervical cancer would be increased substantially, and it could also cause some forms of cancer in boys if they get HPV. So it makes sense to vaccinate against HPV to reduce the risk of getting these forms of cancers. However, there are religious concerns related to the vaccines. So, in many religions, having premarital sex is part of their belief. Sorry, not having premarital sex is a teaching within many religions. Okay, abstinences, right? And so if you encourage people to get the HPV vaccines, then it contradicts with that abstinences-based message, right? And so there was a strong pushback of the HPV mandates from various religious groups, like Catholics, for example, and those are valid arguments. And then there's the anti-vaccine movement. In recent years, many parents are influenced by what's called fringe activists who believe vaccinations cause autism, brain damage, and other misalignment, and therefore refuse to have their kids being vaccinated. And the sad consequences of that is there are an increase in preventable childhood deaths. If you don't vaccinate your kids against, say, measles and mumps, and they come down with it, there's a real good chance that they might die from the disease. There are more community outbreaks of outdated disease, right? Diseases like polio is supposed to be gone, but they are coming back as a result of low vaccination rate, and there are measles and mumps outbreak as well for the same reason, and you have a lot of misinformed, angry parents. So where does this whole notion of vaccination causes autism came from? Well, it all started with this guy. His name is Andrew Wakefield, and he's published a paper in a very prestigious medical journal called The Lancet. And in this article, he claims that there is a link between the MMR, the measles, mumps, rubella vaccine, and autism in kids. However, it was later found that the data he used was fabricated, is not real, and so the journal has since retracted the paper, and many countless papers that come after this has disproved the link. There's no link between the MMR vaccine and autism, but the damage was already done, right? Many people think it's a conspiracy, for example, and there is a huge movement, huge groups that believe that his work was correct, and that's basically what the anti-vaccine movement is. So now we're just going to wrap up the lecture with some other stuff related to immunity, some diseases related immunity. In this picture, you can see that's not a normal looking hand. That is what you get when you have rheumatoid arthritis. So there is the normal kind of arthritis, which is called osteoarthritis, and that's just part of aging. Due to wearing and tearing, and this kind, the rheumatoid arthritis, is an autoimmune disease where your immune system attacks the tissues in your joint, and it causes them to form scar tissue and become deformed. So this of course is very painful. So we're gonna look at three types of abnormalities related to immune system. We're gonna look at what happens when you have a overreaction towards something. We're gonna look at what happens when you have an underreaction, and we will also see what happens when you have the wrong type of reaction. So allergies. Allergies is an overreaction to something that is typically harmless, such as pollen, animal hair, peanut butter, right? That kind of stuff is ordinarily harmless to the body, but certain people are hypersensitive to these things. We don't really have good reasons of why that is the case, but genetics definitely seem to play a factor in that. So the response to these antigens, right, they are called the allergens, are usually involve some kind of tissue damage. And the allergic reaction involves a very specific type of antibodies called IgE antibodies. And in the allergic reaction, the IgE is going to create a very immediate response, and you will know this if you have allergies. Okay, if it's the pollen concentration is high on a particular day, you go out for a walk, and then after half an hour, you might already have the symptoms of watery eyes and runny nose and whatnot, and that's caused by the IgE antibodies. These antibodies are actually stuck to mast cells, and you might remember mast cells are the ones that are responsible for creating the inflammatory response, and they're also stuck in the basophils. And so when the allergens binds to these antibodies, it will trigger the mast cells and the basophil to release histamine, which then is responsible for the allergic symptoms. And so a lot of the allergy drugs, they contain what's called antihistamine, and that is to counteract the effect of histamine. Now, sometimes the allergic response can be very, very severe. In some people, the IgE-mediated allergic response can create what's called an anaphylactic shock. In an anaphylactic shock, you have a systemic, systemic means the entire body, right? Systemic inflammation caused by an increased release of histamine. And with the surge of histamine in the system, you are going to experience a life-threatening drop in blood pressure. Because remember, histamine is going to increase your vasodilation, and it makes them super, super leaky, right? So by leaking a lot of fluid out of your blood vessels, your blood volume is going to go down, and your blood pressure is going to drop significantly. And if you don't have enough blood pressure, then not enough blood can go to your brain, and then you could die from that. So this is very, very serious, and it could happen very, very quickly, right? So if someone is having an anaphylactic shock, or if they have a history of having anaphylactic shock, then they should carry an EpiPen for them. So EpiPen contains epinephrine, which is something that your body makes when you're scared or excited, right? You might probably know it as adrenaline. Okay, adrenaline and epinephrine are the same thing. Okay, so by injecting a shot of epinephrine into your system, it's going to reverse all that histamine effect, and it will allow you to basically live, right, before you get to a hospital. So another example is autoimmune disorder. This is the wrong kind of reaction. Okay, we are supposed to only have T cells that would attack foreign antigens, right? And there are checkpoints in the thymus. Remember we talked about the tolerance test, right? Only 5% of the T cells are supposed to come out from the thymus if they pass the tolerance test. And in cases where we let out the wrong T cells, then they will attack your own cells, and that creates the autoimmune diseases. So there are many different types of autoimmune diseases. Here is one example, Graves' disease. So you have a thyroid gland in the neck area, and the thyroid gland produces thyroid hormone. So just to keep it simple for now, thyroid hormone basically controls your metabolism. So more thyroid hormone, higher the metabolism. So what happens is in Graves' disease, here is your thyroid gland, and you're going to make antibodies that would be stuck to the thyroid gland, okay? And it turns it on permanently. So this would keep on pumping out thyroid hormone. Thyroid hormones are called T3 and T4. And because you have an elevated amount of T3 and T4, your metabolic rate is going to spin out of control. You're going to have uncontrolled weight loss because you're burning up everything you eat. You're going to have irregular heartbeat. It's going to be beating really fast. And the eyes are going to be a little bit bulging. these antibodies not only bind to the thyroid gland, but they also bind to the muscle around the eye, causing them to become inflamed, and as a result, your eyes are going to be a little bit bulgy. So that's an example of autoimmune disorder. Finally, we have immunodeficiency, and that is when you have an underreaction, okay, or no reaction at all. So this comes in two forms. We can have what's called primary immunodeficiency. This is something that you're born with because of genetic mutations, and then there's secondary immunodeficiency, which is something that you acquired after birth. And so an example of primary immunodeficiency is something called SCID, which stands for Severe Combined Immunodeficiency. And an example of secondary immunodeficiency is AIDS, the acquired immunodeficiency, which is caused by the HIV virus. So in SCID, the person is born with no immunity at all. They cannot produce acquired immunity. They cannot produce T cells and B cells, and so what happens is they would die from the most common infection. Okay, they could just die from breathing pathogens in the air that you and I can deal with, but they cannot do it because they lack the mechanism to do so. So there is someone called the Bubble Boy. I don't know if you have heard about Bubble Boy before, but this boy was born with SCID, and his parents could not touch him because just by holding him, they could spread bacteria to the boy and killed him. So he lived in a bubble, a sterile bubble, for the majority of his life. And when he was around 12 years old, they figure out a way to perform bone marrow transplantation from siblings. So he received bone marrow transplantation from his sister. And a bone marrow transplantation is potentially going to fix this because bone marrow is where all the white cells come from, right? So if you get healthy bone marrow from someone else, then maybe you could replenish your own immune system. But what's very unfortunate was that there is a virus called EBV, which stands for Epstein-Barr virus, and that's known to cause things like leukemia. So people who have EBV might not get leukemia all the time because their immune system is able to suppress the virus. But what happens is the sister had EBV but with no symptoms. But once the bone marrow transplantation occurred, because the boy didn't have a complete immune system at the time, the virus manifested itself, and shortly after the transplantation, the boy actually died from the Epstein-Barr virus related illness. And so they actually made a movie for this. If you're interested, you can probably search it up on YouTube or something. So nowadays, we use gene therapy to correct for SCID. The idea is to replace the defective gene with a functional copy, and there are promising results, right? Bubble babies, as they're called now, still exist. People still born with SCID nowadays, and by using gene therapy, maybe we'll be able to fix this problem in the near future. ACE, acquired immune deficiency syndrome, or which is caused by the HIV virus, that can shut down your entire immune system, because the HIV virus actually has a preference in infecting things like macrophages, APCs, and helper T cells. And you know that the APCs and the macrophages are important for activating the acquired immunity. And so without those, you basically don't have any cell-mediated response. And even if you are able to get some T cells, the helper T cells will also be infected by the HIV. And so you will not have any antibody production capability. And for that reason, people with HIV are very susceptible to common infections. And usually they die because of these common infections and not because of the HIV themselves. Now, the interesting thing is this: some people do not get HIV at all because they have a mutation in something called a CXCR receptor. So, in order for the virus to gain entries to these cells, they require that receptor. And if you have a mutation in that receptor, the virus actually does not recognize it, and therefore not going to be able to infect the cells. And so people with that mutations are immune to HIV. So that created a very interesting case. There was someone there is someone, he's still alive, named Timothy Ray Brown, and for the longest time he was referred to as just the Berlin patient. So what happens was this: he had HIV, and for another reason, unrelated reason, he needed a bone marrow transplantation. Okay, so they found a donor for him, a match donor, and they gave him the bone marrow transplantation. And what was really surprising to the doctors at the time was that after the bone marrow transplantation, they started noticing his HIV viral load start to go down, and eventually it was completely gone. So essentially, he was cured from the HIV because of the bone marrow transplantation. So what happened was that the donor, the bone marrow donor, happened to have that mutation that I was talking about, the CXCR mutation, and as a result, when he donated his bone marrow, all that new white cells that Timothy made also contained that same mutation, and therefore the virus ran out of things to infect, and it just kind of cured him. So this is very, very rare because number one, the number of people who have that CXCR mutation is super, super rare, perhaps like 0.1% of the entire world's population. And even if you find someone who has that mutation, they have to be a suitable bone marrow donor in order for this to occur. So that was the only case up until last year. So last year, there was a second case where another HIV patient was cured by the same means. And that's when Timothy decided to no longer remain anonymous. He wanted to tell his stories, right? Basically to give hope to other HIV patients and tell them about his success story. And that's it for lecture 3. So as usual, please work on your workbook, and if you have any question, feel free to contact me. Thank you for watching.